currently serving in the West Midlands Police Force, working in the Birmingham area. I have daily dealings with drug-related matters in the area where I work. The Misuse of Drugs Act was passed in Parliament in 1971, and the Act basically covers possession of a controlled drug unlawfully, possession of a controlled drug with intent to supply it, supplying or offering to supply a controlled drug, and also allowing premises you occupy or manage to be used unlawfully for a purpose of producing or supplying controlled drugs. When the Act was made, the classes of drugs were set at Class A, Class B and Class C, with Class A being the most serious. Class A incorporates drugs such as heroin, cocaine, crack, MDMA, commonly known as ecstasy, LSD. Class B, the main ones, amphetamine, cannabis and codeine, and Class C, ketamine, diazepam and GHB. Class A, being the most serious, carries the biggest penalties. Possession of a Class A drug, you could look at up to 6 months in prison and a £5,000 fine for possession. For supply of it, you could be looking at 6 months in prison and a £5,000 fine if it was at magistrate's court. For more serious offences of possession and supply, you could be looking at up to 7 years in prison with an unlimited fine, and for supply, lifetime imprisonment, and again, an unlimited fine. The possession of a Class B drug, the penalties are, if it's at magistrate's court, either 3 months or 6 months imprisonment, and a fine up to £5,000, and for supply, between 5 years and 14 years in prison with an unlimited fine. And Class C drugs, the possession, the penalty are 3 months inside prison and a fine not exceeding £2,000, and for supply, up to 14 years in prison, and again, an unlimited fine. Now, drugs are quite rife in our community and probably underpin most jobs that police officers go to on a daily basis. Getting involved in drugs often lead people and young people onto committing other offences, fuel a habit, mainly theft and prostitution. Now, 8 out of 10 jobs I'd say that I deal with on a daily basis are due to the person being addicted to a drug and the lifestyle that comes with it. And unfortunately, once people start down that line, it's very hard to get back. Not only does it affect your health, your well-being, social status, financial status, it's a very difficult thing to get off, and I would discourage any person, any young person, from ever going anywhere near a controlled substance.
Education system is talking enough about drugs within science itself?
Within science, at the moment, the current GCSE that we do at Small Heath, there is coverage of tobacco, alcohol, and other drugs. So I think there is some coverage in GCSE. Key Stage 3, it's not compulsory now to cover drugs. It's only what determined by a sort of school subject work.
Do you think it is enough, or enough information being given out to young people?
I think it asks a question because obviously there's lots of things going on outside of school, lots of programs outside of school to try and raise awareness. And as sort of coordinator of our personal development curriculum, we do spend at least sort of a month in our tutorial sessions for each year group discussing drugs. So in school ourselves, I think we try to. In other schools, possibly that don't have as much time for literacy, it could be a bit less because it's not compulsory. So some schools may have to do extra maths or English instead of that.
Do you think the discouraging of drugs in the school is enough, and how can it be improved?
I think we do quite a good job. In terms of improvements, we used to have a school-based police officer, and if we had any